Hi, everyone. We're very excited that you could join us today. We're going to be talking about community building. We're going to be using the example of two groups that are working directly on community building, one being Focus Act Connect Every Day, and the other be the West River Neighborhood Services Corporation. So we'll be talking about those two as examples of community building and some of the things we've learned through that process. So I'm going to introduce the panelists. We have a great group of panelists with decades and decades of combined community building experience. I'm going to do a quick slideshow, and then we will introduce the panelists and get started with some of the wisdom that they bring to the table to share with you all. We also encourage people to put things in the chat along the way. If you have questions, if you have comments about your own experiences, that kind of thing, please feel free to put it in the chat. We would love to make this as much of a dialogue as we can. So this is the logo for the Focus Act Connect Every Day, the FACE group. And we'll be talking a little bit much more about that as we go, but these are some of the values that the group decided are the most important for the group, and that's the logo that we use when we're. The next is, I just wanted to show some stuff from our involvement with the International Day of Peace Festival, which we'll be talking a little bit about in the West River neighborhood. This is the way that we've gotten directly involved. This is our first time there in 2016. And some of these people will pop on the screen soon. You'll get to see them. But this is sort of the original group of FACE that started in 2016. Another one of our presenters here, Virginia Spell, who we'll be introducing in a moment, and her husband Stacy filling out one of the community murals, which we'll be talking a little bit more about. Here is actually one of the community murals. You can see that it's incredibly colorful, vibrant, lots of power and input from the community on there. A really incredible experience that we'll talk a little bit also more about. FACE is also does a lot of sort of community building through giving back to organizations that help some of our members and others to get the things we need in life. So this is us helping to pack groceries at Thanksgiving, which we do every year at one of the organizations that delivers groceries to the homebound. Here's a FACE meeting. So we'll be talking about FACE getting together every week and talking and planning together. Here again is another example of mural building in the community. And there are a few of the murals with Bridget, who you will get to meet and hear from in just a moment. We've done about maybe 10 murals or so, 12 murals over the years. And so here's Bridget with a few of them when we hung them up to look at them all together in the same place. Oh, that's going to be at the end. So I'm going to stop my share here and introduce you to the panelists. So I'm thrilled to introduce our panelists here today. We really, like I said, have an incredibly strong panel, people with many decades combined and many decades individually, a lot of them in building community and doing it really on a direct grassroots level, very inclusive community. I'll start with Virginia Spell, who is the interim CEO of the Urban League of Southern Connecticut, also the board chair of Continuum of Care, which is a local large mental health nonprofit organization in New Haven, Connecticut, where we're all based, and also the president of the West River Neighborhood Services Corporation. Marcus Griffin is a longtime neighborhood activist and political activist, and is also a founding member of FACE. Bridget Williamson is the co-director of the Citizens Project here in New Haven, and also a founding member of FACE. Paul Acker is a mental health advocate since 2006 and is also the program manager of Advocacy Unlimited, a peer-run advocacy and wellness organization he can tell you more about here in Connecticut. And my name is Billy Brummage. I am the director of community organizing at Yale Program for Recovery and Community Health, as well as the Connecticut Mental Health Center, and also a founding member of the FACE group. So I'm going to now put some questions to our panelists. I'd love to get us started so you can hear from some of the great things that they're able to share with us. So the first question, I wanted to start off with a question to Bridget and Mark. Could you tell us a little bit about what FACE is, the Focus Act Connect Everyday group?
I'll start, Bridget, or you want me?
Go ahead, you can start.
All right. Well, again, my name is Mark Griffin. I've been a long time activist in my neighborhood. And when Billy Brummers had brought the idea to Fellowship Place, which I belong to, um, I didn't know where we were going to go with this. And at that time, we're talking about different things, how to interact with people, and how to bring people together. Um, it was the same idea I had of, building a neighborhood, getting to know each other. And at the same time, we met at Fellowship Place, and then we moved it over to the Yale bookstore. And then after that, we started moving around. But at the same time, we're bringing in folks. And what was the idea of letting the city of New Haven know what we were about? And at the same time, first we started out talking about homelessness, and then we talked about different other stuff. And at the same time, me being in the Dwight neighborhood, saying good morning to folks. I don't know how many times I've done it, but I met new people. And then later on, then the idea of reaching out to different ones and letting the city know what we're doing. And what was the situation? What was the problem that we had in mind of reaching out to different ones, finding out what was their needs? You know what I mean? People of color, people of race with mental illness, and at the same time to take that problem and turn it into some type of solution. And I'm proud of wearing my face shirt, all the ones that we made over the years, and meeting together, meeting different ones, and bringing our ideas to the West River, and bringing our ideas to Dwight management. And at the same time, we came up with different 20 murals, and people signing them, and people were wondering, what is this about? You know what I mean? And let us know where you're at and how you feel. What would you like to see change? You know what I mean? And at the same time, I'm proud of the group face. You know what I mean? As I this past summer, even doing this, we haven't met that much. What we did on virtual, and even when I'm outside walking, if I happen to have my T-shirt on, people ask, "Wow, what does that mean?" You know what I mean? And then you meet people and say, "Wow, we understand what the words on your shirt mean." And at the same time, it's everyday living life on life terms, smiling and, hey, good morning, how are you? Um, you know, what do you think? What kind of change do you think the neighborhood might need? Whether it's in Dwight, whether it's in the Hill, West River, you know what I mean? It's just amazing of the ideas that we had, and we brought it together. And the group is growing. We it was just this pandemic, the original ones, we're still here. And then along the way, we came up with an idea reaching out to the ones that we did lost during this pandemic. And, with me, and I'm going to say this and I'm going to shut it down, I have the heart in my mind, in my heart, of doing what I do best. And at the same time, letting people know whatever you're going through, you don't have to do this alone, and that we can get through the situation that we're in. And I want to thank Billy for bringing that idea. It's been, 5 years now? And we grown. We had grown, and still bringing new ideas to the table. You know what I mean? But I wish I could say more, but I'm going to leave some more to Bridget.
Thank you, Marcus.
So, yeah, thank you, Marcus. But for me, my worldview of faith is a place where people can gather together with shared decision and meeting on a positive and a vibrant way. I literally never had been to a meeting like this. This is why I keep going, because of the connection, the keeping it 100 there. You don't have to talk about mental health, even though I do have mental health and substance abuse problem, which I used to have substance abuse problem. But it is a place where people are being treated like human beings, and don't nothing go by without everyone input there. People are being validated, have a voice, where, in other words, if they were somewhere else, they wouldn't have a voice. My relationship building with the individuals there, I would have never had it if I didn't continue to come to FACE. I just think FACE is a place where people are just looking for change, and people can just say hello. We all say hello to at least 10 plus people a day. So I'm not going to be long with it, Bill, because we got a lot of panelists. But that's what it means
Thank
to
you,
me.
Bridget. I think that's great. And FACE has been a group that's been meeting, like Marcus said, regularly now for 5 years, and really with the focus on building community. And we'll talk a little bit more about how it fits in with mental health. Some members of the group are people with lived experience of mental illness or mental health struggles. Others are not, so it's not really defined that way. But I want to ask Virginia a little bit about the grassroots organizing you do in West River, because when FACE was getting started and we decided what we really wanted to do, Marcus talked about doing an event about homelessness in New Haven, and then realized there's a lot of people doing some wonderful work in New Haven, so why not lend our hand to what's already happening? And West River was a really logical choice for us. Some of us had lived in West River or spent time in West River. We had friends in West River. And what West River was doing is really sort of an open arms approach to community building. And so I wonder, Virginia, if you could tell us a little bit about that.
Absolutely, and thank you for having Billy. So West River is a neighborhood in New Haven, which New Haven is a city of approximately 130 residents, and so we're one of 10 neighborhoods in our lovely city. And the West River Neighborhood Service Corporation, which is over 30 years old, our focus has always been on being a caring, green community, and one aspect of that has always been about community building and community cohesion. And what we found was that we had a variety of partners that were interested in ensuring that it remained an inclusive community. So when we had the opportunity to work with FACE on community building, it was an opportunity to show on a larger scale the city of New Haven that we were committed to being inclusive to all, and that we were supportive of residents who were struggling with mental illness or substance abuse. And we wanted to be that community that wrapped its arm around its residents and found a way to support our neighbors in a way that some of the other neighborhoods in the city of New Haven had not done so. So through that relationship, we've done everything from annually we have an International Day of Peace, which FACE has been a huge supporter of and a partner through. We host a holiday party in our community every year. We have monthly meets that FACE participants and residents in our West River community have an open or two and attend and join in our community building work, whether it's working our community garden or community cleanups or advancing whatever the interest is of our residents. But the primary focus was on building a strong community by being inclusive to all.
Thank you, Virginia. So that's and I wanted to I guess I wanted to turn it to Paul for a moment. I really heard you, Paul, many times talk really beautifully about that the importance of community as part of sort of the healing process for people that are often left out of community, and also how that ties together to how that benefits community as well. And I'm wondering if you might say a little bit about that.
Yeah, sure. I really do think that, as we're looking at people healing, connection is such a huge part in that. The power of connection can help us transform. It gives us kind of the support that we need to take those steps, to take those risks, to to move forward. And, you know, one of the things that I really love about FACE is that it's kind of resewing the fabric of the community back together again. And it's starting with the people who traditionally have been left out. People with mental health and addiction problems, we in the past would, you know, tend to get them out of our sight, you know, so we put them in jails, we put them in psych hospitals, and then we decided, oh well, that's not good, and we said, okay, you can come back out, but then we just kind of siloed them in the community and kind of institutionalized them in the community. FACE is actually giving them a voice, and so we see how this group, you know, getting together and connecting within the community is good for the people that are involved in the group. But then when you look at what's happening with West River, they're actually going out and making a change in their community. And, you know, the old saying goes, the people closest to the problem are the ones closest to the solution. They just don't have the resources. And so it's getting those people who are close to the problem and trying to get them to those resources so that they can change what's going on. I mean, I think a lot of, you know, we've seen rates double of people ending up on Social Security disability. And, you know, at least from my perspective, I feel like we've lost that connection. We've lost connection to church. We've lost connection to community. We've lost connection to each other in a way that has kind of doubled the rate at which people are getting disabled. And I really feel that, you know, reconnecting people and having them be a part of these communities will help reverse that trend.
Thank you, Paul. Yeah, I definitely agree with that. And I wonder if Bridget and Virginia and Marcus, to a lot of extent, spent most of your life in New Haven. And I wonder how over time doing this kind of work, this community building work that you're doing, how it's changed your worldview, how it's made you think about yourself and about your place in the world, how community has done that and changed that view for you, and you know, given you tools or ways of being that are important to you as fundamentally to who you are.
So Billy, I'm gonna say this because I've been dying to say something, especially with Miss Virginia, because it's important how we enter and exit a community, right? So it's important to how we go inside of a community. And a lot of times we hear all this bad stuff on the news and in the media about these communities doing all this and that and the third. But the thing is that a lot of these communities are doing good work. So this is how we enter in West River, right? And started doing all this stuff. But I do think when we talking about building these relationships, because it's so important, like Paul said about connection, nothing be done without connecting to people. And a lot of the people that's getting services at a CMHC or North Side or Hill Health Center, they live in these communities. So I think it's important for us, because a lot of times we spend a lot of time in the community. We go to get our needs met in the agencies. We probably spend an hour there, if that, but the majority of times we are out here. So I think it's important for us to connect with the communities that they're already doing good work, because I know when I was out here doing wrong, I did a lot of bad things in this community. So it was so important for me to tap into West River, to tap into FACE, to tap into a Witness to Hunger, because I want to help change and help shift people's mind about these communities, especially the media.
I think that's so well said, Bridget. I know my personal experience, I'm a nonprofit manager by trade. So a good portion of my professional career has been spent serving Hartford County, Fairfield County, and my focus shifted over the last couple of years, and I see things in my own community that I really never saw before because of this work. So being in the community, getting to know the residents. My husband tells a joke all the time that he used to, he was from a law enforcement background, and he says hi to everybody. And I be moving through my community, going to the train station, getting on, leaving the community, and I didn't know people in the community. And I didn't realize the struggle that folks in my neighborhood were dealing with. And I'm a nonprofit manager. I'm going to another city and to solve their ills and their woes. But focusing on my community and stopping and just saying hi to people, the impact that has, and showing people that you care about what your neighbor is going through and the impact of that. Paul made a great statement about, the lack of cohesiveness when it comes to, we don't connect through church. We don't connect with our neighbors in a way that benefits community. And that's what we've tried to change in West River. We've tried to be that anchor in the community, that respite, and as a place to go, and as a place that will care about you and want you to stay in care and want you to be physically healthy, mentally healthy, and support you through any incidents of substance abuse. And that's something that we saw was lacking in our community. So as I reshifted my focus on New Haven, on West River, my eyes became open to really, Bridget may have gone through, and I could have been standing next to her and never been aware of it. So it opened my eyes to the need for us to wrap our arms as a community and as individuals around everybody in our neighborhood that may need support, whether it's something on the physical side, the mental side, even basic needs. I think, we become a better society when we care about each other. And this was one way that West River wanted to stop and represent ourselves. Bridget, enter and exit in the community that way.
Wow. Go ahead, Paul.
Yeah, I mean, Virginia, you just like opened this whole stream of thought for me, because really, when you think of it, the best safety net we can make is not one with agencies, but one with neighbors. Your neighbor is always going to be closer than any agency. My neighbor might take me in if I had a fire at a house, as opposed to an agency that would have to find a place for me. My neighbor will help me if I've lost my job and I might need a little help with the food. I will help my neighbor, and that's the best safety net we can make, because people understand the context of what's going on in that neighborhood, right? And when you were talking about going into another town, you had to learn a whole different context than the very context of the neighborhood that you're in. And so it really is important to have these connections in the context to help us build stronger communities to the point where we need less agents. We need less government funded agencies, because we have each other.
Bill, can I just say one thing? And I agree, Paul, with the whole panelists, because it's people that helps people move forward. I'm not knocking clinicians and doctors, because they do great work, right? We need them. We need them on this earth, right, to help people move forward also. But again, for me, it's people that help me get through my recovery with the substance abuse piece of the heroin, piece of the cocaine. And it wasn't so much the agency. The agency would allow me to go inside and stay to get clean. But the work was when I left the agency and got out, I had to continue doing the footwork. So it was people that helped me to keep my recovery since 1991, September 25th. Thank you.
And you know what? I was crying for a little bit because I didn't get here until about 93, 94. And my father's sister was living here. And I had just came home from a program. And by the grace of God, I'm coming up on 28, clean and sober, you know what I mean? But I don't forget where I came from. But since the time I've been here, I don't know how many men and women from the West River and my area came up to me and said, what's working for you? Because we want to know what's working for you, because we want what you have. And at the same time, I don't forget where I came from, because there was times when I was lost in New Haven on Grand Avenue, didn't know where my life was going to be at. And at the same time, Virginia, I want to thank you and your husband for doing a great job over there, because there were some people who used to live here who told me about West River. And then I done some history, and then I learned more history between the West River and the White area. And at the same time, I'm not afraid to walk into West River and talk to men and women and giving them what I have and share with them how to make it through this journey, because a lot of folks in the West River, and I've spoken over the last 5 years, you know what I mean? Mr. Griffin, we don't know where this is. We don't know where that is. And they didn't know what was available, but for me to sit up there and jot down what's available for them in their neighborhood, to let them know what's available for them. Because a lot of them, they didn't know. So I was able to sit up there and help them along the way. And because even with me, I had to learn more about the neighbors, and the neighbors, we communicate. You know, without neighbors communicating with each other, we cannot build nothing. And at the same time, I'm so happy to be part of not just my neighborhood, but be a part of the history of West River. Because every time I go there, I meet new people. But it's amazing how this journey is continue. You know, and just like what Bridget said earlier, you know what I mean? Because every time you turn on the news, I'm like, yo, it's not like that. Y'all are not in that neighborhood, so you don't know what's going on there. So, you know, at the same time, it's like the question that I used to ask the young men and women, what do y'all want? And we would sit down and have our own little discussion, you know what I mean? And majority of the men and women now that I did spoke to over the last couple of years, they're doing better, you know what I mean? And there's still work that needs to be done. I just had to say that.
Thank you. And I wondered if Virginia and Bridget, if you'd be willing to share the story about what happened when the person came with the concerns about the sober house to the West River meeting, the monthly meeting. And I wonder if you might share that, because I think that really is a great example of what everyone's been talking about here in the last few minutes.
So I'm gonna let Miss Virginia talk about it, and then I can chime in afterwards.
Okay, so this is an example of community that I think resonates all of us on the line today, on the conference today. We, at our monthly meeting, we give our residents an opportunity to voice concerns. During our meeting, we have law enforcement there, we have community there. And residents will often raise concerns about issues that arise in our community. One such meeting, we had a faith group attend, and they were concerned about a sober house that was moving in right into West River. And there was significant pushback from the residents because, as I mentioned earlier, we pride ourselves on being a caring community and in being to all, regardless of your life experience. And there was significant pushback because that's not who West River is. We were not going to exclude a group or groups because of their life experience. And residents were really up in arms and said, you know, if a sober house coming to the neighborhood, it's coming to the neighborhood. We're not going to support a faith group or organization that would be opposed to that. So that's kind of, Bridget tells it better. So Bridget, I'll let you take it from there.
Thank you so much, Miss Virginia. And Miss Virginia stated it. That's the way it happened. And I was sitting there listening to her and my discomfort, and I didn't know how to say it because, again, we entering in their space, but it was a very safe space for me to open up. And I said, man, I hear this lady talking, and she's, you know, very negative about the sober house. And I just raised my hand and asked, can I speak? And Miss Virginia told me yes, because she was facilitating the meeting. I looked at the young lady and I said, ma'am, I said, you know, I used to be on heroin and cocaine, and I was, you know, out here real bad. And, you know, God delivered me from that stuff. And now, you know, I'm a changed woman. So the people that you're talking about, the druggy people, it was me, but I'm not that way today. So, you know, I think that everyone should be given a fair chance. And sometimes it takes longer than others. So maybe it can be by, you know, another chance and another chance. I don't know, because it took me one time to get clean and I haven't went back, but I had to advocate and lobby for people that have changed their life, because everybody that's in that community or everybody that's black and brown are not drug dealers or drug users. So I had to let that be known and at the meeting. Thank you, Bill.
Thank you. So I wanted to, you know, it might be obvious in some ways from some of the things we've been saying, we've been touching on it, but I wanted to talk about how some of this stuff is different than sort of the mental health system and the way the mental health system does things. We've been talking about recovery or the substance abuse system. We've been talking about recovery. And I know, like, you know, I definitely want to hear from all the panelists have incredible knowledge on this. But I wanted to start by asking you, Virginia. I know you framed it before that the West River Neighborhood Service Corporation is not a service delivery group, and you've been talking about that. I wonder if you might expand on that and how what you're doing is really fundamentally different than service delivery.
So I think that's critical to when you think about community organizing and community building, is having a neutral partner, which I consider West River to be, a neutral partner that's there after clinicians go home, after, you know, the doctors who provide care are no longer available or at home with their families. West River Neighborhoods Corporation, its members are there on Sundays and in evenings, and we are there when often care is not available. So holidays, when folks home with their families, we're still there building community. We're still there to support our neighbor regardless of their life experience, and we're there providing an alternative to care because we care. And I think that's probably the best way to frame it. We care about our neighbor, people who live in our community, and the you know, the broader world. I mean, I don't want to narrow it to a small section. It's not just West River. There are a lot of communities in New Haven and surrounding towns and across the state that care about the people who live next door to them and want to be there, want to be an anchor and support the health and wellness of the residents in the community and the people that they don't necessarily serve. No, we're not a service delivery organization. We are all volunteers. We are all neighbors. We have a leadership group, but it's really by the members. It's the members who tell us what they'd like to see happen in our community. And one of the things, I'll go back to it, is that neighborhood cohesion and the importance of being there for each other is cool, we think, to our mental health as well as the care of our community.
Thank you. And I wanted to talk about particularly people that have been involved with FACE, and Paul, you certainly are included in that group. You've been involved with FACE for a while now. I just wanted to, I know when we were talking about this conversation, when we sort of proposing it, that we talked about the importance of in FACE and when people are in West River and other neighborhoods, the idea that we're not playing a mental health role, that people are playing neighbor, community member, community builder role. And I wonder if anyone on the panel might want to talk about how that is really an important distinction and how that really makes a difference for how we interact with community, our community, when we're thinking of ourselves in that way.
Oh, you know what? You know, as many people that I came upon over the years, you know what I mean? And there's so many people who are not addicts, and there's so many people that I met who are not, who doesn't have mental illness, but at the same time, sitting around each other and talking about how we're gonna take the problem and turn into some type of solution, you know, and even talking about what resources available for those that may have a problem. And as I listened to Virginia, I was thinking about, you know, sometimes when it's close to the weekend, there's some things available for some folks, and there's some things that are not available for folks. And there's folks, as we've been going through this pandemic, that that I ran into or even talked to online. How are you getting through this, Mr. Griffin? And the communication of different ones from different parts of New Haven, you know, and I was wondering, how do you guys get my information? And even for them to sit up there to even write to my email, or even hit me up on Facebook, or even got my number from somewhere, and then we talking about how we're getting through this. We lifting each other up through this time. You know what I mean? Some folks didn't know how, if they was gonna go to the polls and vote. Some people didn't know if that place is gonna be open. You know, and just the fact that on a regular basis over the last 8 months, communicating with different ones, and whether they knew me or not, we're communicating. You know, and I just thank God at this point, you know what I mean, that because I tell anybody, it ain't about me. It's about helping the next man and woman get through this situation that we're going through right now. And I'm going to share this. The group of us got together maybe about a month ago, and I was able to get space. 10 of us met, and we all drew down on paper. We drew it on paper. How our life is getting through what we're going through right now. And some people talked about depression. Some people talked about where they would like to be at. And I talked about, well, I would like to go on a trip or something, but at the same time, we all came together, Billy. We all came together and talked about it. We drew it on paper, you know what I mean? It was amazing. And as I speak right now, I'm happy to be where I'm at right now. And my door is always open for folks that's going through something. I just had to share that, you know what I mean? Because ain't no big I, big you in this situation that we're going through.
Thank you, Marcus. Does anyone want to add to that? About, I wonder if it might be sort of here talking about this kind of thing about the big I, small U, and that kind of thing. If somebody might want to talk about the importance of the idea of working through like sharing the decision making, people having a space to decide what they want to do together. Particularly, you know, both in Virginia's talked a bit about it in West River, but also we've talked a lot about it, or we talk about it a lot in FACE, that we sort of really based on consensus, and that the group really decides everything together. And I wonder if anyone has any comments about the importance of that.
Well, I think it's integral that we shift the focus from me to we, right? That the more people that we can bring along, the more power we're going to have. The more that we are going to be able to support each other. When it's about me, it's like everyone brings things to me as opposed to us distributing it through each other. And I found actually the decision making that, you know, hey, when everyone's on board, we take a step is actually pretty cool, because then there is that consensus building. There is that, hey guys, why don't we try this? And it's okay for someone to say no, you know, and then we go back to the drawing board, and it really has, just for my own self, it's changed the way that I look at things, because my thought process is more inclusive of, well, how do we include everybody? As opposed to, well, okay, why don't you go do what you want to do and we'll go do this. And I think it builds a stronger community. It builds that trust, that is so important, that I feel like we've lost sometimes.
I would agree. One thing that I think makes West River work is that it is all about consensus. It is very often communities, especially community of color, and then you add to that any type of other bias that's instituted exists, and my urban league hat might showing up. But what we found is that we're never asked, what do you think, or how do you feel, or you know, who should be at the table. So having a community neighborhood that's committed to that, no matter what we look at like, and we are very racially we're very well racially represented in West River. We're probably one of few communities in the city of New Haven that has 7 different types of places of worship, from the mosque to Seventh-day Adventist to Jehovah's Witness to every, you know, Christian church. I mean, we represent a microcosm of what we would hope our world would look like. And to have people invited to the table and ask for their voice, we get to do that with face. We get to say, you know, come in and be a part of us, because we together make and build a better community. And your voice is important to us, and your opinion is important to us, and what you'd like to see your neighborhood look like is important to us. And using that model is what I think makes us a very successful community organization that is comprised solely of volunteers that are giving of their time and their talent. And we open up our arms to face and we say, you've got talent, you've got time, please, and share with us what you would like the ideal community look like. So, you know, to Paul's point, when we take out the I and it's just about us and we, that I can't see any problem with building a stronger, healthier community if we use that focus.
Okay, I was going to invite you to speak, Bridget, but you unmuted, so go ahead.
No, but I'll be quick. So I can give you an example. We sitting in a meeting. We've been meeting frequently, you know, and we've been trying to figure out the color of the shirts. And so it took us like 2-3 months to try to narrow down a color of a shirt. So at the end of the meeting, I had to excuse myself to use the bathroom. And when I came back, everybody's like, yay, 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 we got the color. So I said, you know, after almost 3 months, you know, we've been scrapping about this color, and they already agreed to the color. I was in the bathroom, you know, paying the water bill. I come back, they said, I said, so what's the color? And they told me, and I was like, I thought about it, and I said, you know, I hate to, you know, damper the parade here, but I'm thinking about wearing this shirt, you know, around in the community, wearing it to an event. I said, I don't think I like that color. They was like, oh, you gotta be kidding, Bridget. So now we had to go back to the table because everyone had agreed that they wanted that color. And I just didn't feel comfortable not being a pain in their neck or anything, but I'm thinking about wearing this shirt, not just at Face, but somewhere else in the community. I'm saying I'm not wearing that in my community. And we had to go back to the table and revamp the decision until all of us agree. That's what's so powerful about Face. Doesn't nothing move forward until everybody's on board, because it's so important for people to be validated about what they're talking about in their experience.
It's amazing how you talked about that, Bridget. Remember, we were trying to come up with a name, you know, and it took us a while to sit up there, voice our opinion. We kept meeting, and then finally we came up with a name, what it stands for, what it meant in the community, you know what I mean? And over the years, like I said, when I got down to the Peace Festival, I just saw a whole new outlook of life over there. You know what I mean? With the international music and then different ones coming to the Peace Festival and wondering what we was about and then just interact, you know, not just shown, you know, it wasn't just about talking, it was just the fact that we were smiling to have a good conversation and people writing their input on the mural. And then after a year, and then, you know, 1 year, then next year, and then meeting young kids and meeting different ones coming from other parts of New Haven, coming to the Peace Festival. You know, it was amazing. And as I look at some of the pictures that I have on my computer, it's like, wow, we came a long way. Because I mean, we met, and then we was discussing the name, and just like what Bridget was talking about, she happened to go to the restroom. She come back, we already came up with a color of the t-shirt, you know what I mean? And then all the words that came on the front and the back, you know what I mean? But
Marcus, can I say this? Can I say this? And I don't know what that noise is, but I want to be mindful of the time. I would just want to say this before we get off this air. I have a hard time trusting people. I have a trust issue. And I have been having that ever since I was probably 11 in the streets, right? And what Face really helped me do is be able to put my guards down to people that's just like me, that's struggling, that don't fit in. It helped me be able to put my guards down and to trust people. Because again, I would never have the relationships with the people at Face, with the people at West River, with the people at Witness to Hunger, if I didn't interface as, you know, keeping it 100 and letting the people in, because I always usually keep people out. So I thought that was important for me to say. I'm done.
Very important. Thank you, Bridget. I wanted to just, we have a few minutes left here, and I just wanted to, you know, acknowledge that, you know, we've lost many of our friends and neighbors this year to COVID. Our lives, those that, everyone's life has been changed in some way, mostly not for the better for most people. And I wonder, you know, we've been talking about a lot of wonderful stuff, and I'm wondering how anyone that wants to chime in about how you've adapted to COVID, how you've continued your community building, how that's been challenged, how community maybe has taken on new value to you or the people you work with during COVID. Anything from, you know, ways you changed your work to more the values of it. So anyone feel free to please jump in on that.
So for the West River Neighborhood Service Corporation, like many organizations, we've gone to Zoom to host our board meetings as well as our monthly membership meetings. But it is really highlighted the fact that there's definitely a technology gap. A lot of our residents are up in age and are not comfortable with Zoom or any type of technology for meetings. So that's been a struggle. It also has been a struggle because we're all huggers in West River. So not being able to reach out and hug our member who just celebrated her 86th birthday, and, you know, to go by and check on her and to talk to her through a window, it's been a challenge. But what it has made us resolve to do is to to continue to find ways connect with our community. And I'm mindful of our residents who are struggling, and whether it be food insecurity or substance use or mental health, whatever it is, if you can't get out and connect with your neighbors and lean on your neighbors, it's been hard for all of us. So we continue to look for ways to bridge that gap. We've done everything from drop off candy to folks' doorstep to, make sure that folks have masks and make sure folks have food. But we know that's a small piece of what individuals need to stay in care and to be healthy. So we are constantly looking for ways to adjust. We're prayerful that this won't last for another year, because we do have concern for our neighbors. And we keep looking for ways to adjust and adapt to what could possibly be a new normal. So it's been difficult.
Does anyone else want to add about their thoughts about the importance of community? Or Paul, I wonder if I could put you on the spot to talk about how I've heard you say very in a really nice way several times since COVID started, since we've been working together, about sort of how this may have broken down barriers to who's part of community, who needs community, what community is about. And I wonder, in terms of making connections, the importance that we've all felt in that. So I wonder if you might add something there.
Okay, and maybe we can pop up a poll while I'm talking about community. It's kind of funny because to me, I think COVID has kind of been the great leveler. We no longer saw this hierarchy in people. It's something that affected everyone, where everyone had to isolate and everyone had to start to understand what it's like to not have community and to not have these opportunities that we take every day to connect to people. Right? As Virginia was talking about, going around the neighborhood and giving people hugs, that had to stop. You look at it from a mental health perspective. It's not just the person with the diagnosis that has to isolate. It's the person that's trying to help the person with the diagnosis that has to isolate. And so it stops becoming wow, I really feel sorry for, that you have to go through that, to, what, we're in this together. And that there really isn't a hierarchy. There's a mutuality in this that to me is just beautiful. It creates this it stops us from looking at people as being vulnerable and helpless, and starts to look at people with lived experience in the mental health field as people who've been through a lot. And I've known people who work as case managers and who work as clinicians who have struggled with this, with COVID and having to isolate, and to see them, finally get that, hey, it's just one disease away from understanding what, everyone else with a diagnosis has gone through. To me, I think it creates it kind of resets the playing field. So
I think that's a beautiful way to look at it, and I it stops being other. Everybody is other now. Everybody is having to confront this pandemic that's impacting all of us. So it is, although we strive to look for creative ways to minimize the impact, we are still all feeling it. I mean, I can't remember the last time I gave you a Billy. Can't remember the last time I had kids. So it is, as much as my neighbors are feeling the isolation, you know, we at home are feeling it too. We're so used to be able to touch each other and say it's going to be okay. But now, you know, we've had to have people come to us and make sure that we understand that we're going to be okay as well. So I love that perspective, Paul, of thinking about it. It is really, it's a, I hate to say this out loud, but it's a blessing in disguise, because it forces us to really look at, you know, how does community think of other, and we are now other. So do we look at ourselves differently? And will my approach to community organizing change once the veil of COVID has been lifted, God willing?
Yeah.
Thank you. I want to thank both of y'all. I was on a Zoom meeting this morning, and people was talking about the holidays coming up, and that the fact that the information was that it's going to be a short one for a group of people to even celebrate Thanksgiving. And the fact that some folks had even asked me, what do you think? I said, well, if you have to cut it down to maybe 6 of y'all celebrating Thanksgiving, you may have to do that. You can't, and some people were like, and then one guy was telling me it was probably just me and his wife, and then others would say, I may be alone. And then at the same time, Miss Virginia, you was saying, it probably take a whole year before we get through this. But at the same time, not everybody has this technology that we have right now. You know what I mean? Some people may not have a laptop, and they may not have the other device. I can't think right now, but even some folks may not even get the Zoom on their phone. But like you said earlier, a lot of folks don't even want to do the Zoom. But and as I was talking to different ones there this morning, and so, we all can get through this. Some people gave out their phone numbers, you know what I mean? Because some folks don't like to, do the text. But, it's just amazing how we all come together, you know what I mean? Even where I live at, there's folks don't have this technology. But, I just thank God that we're able to come up with some type of solution to get through this time and through the holiday time. That's all I have to say.
Thank you, Marcus. And I want to, we're a little over 3 now, and I want to thank all the panelists very much. This has been a really meaningful conversation. I always learn from each one of you, and I learned again today. It really has been a powerful conversation. So I want to thank you all for taking this time to share your wisdom and experience with us. It's been very meaningful. And I also want to thank everyone who joined us. I know there's a lot of demands on our time now, and I really appreciate everyone coming and spending time with us to learn and to share in the comments some of your thoughts. And I also really want to thank Vanessa and Graziella, who are behind the scenes, but really made this whole thing work and made it so our conversation can happen. So I want to make sure to thank them too. And we'll look forward to hopefully seeing some of you again. And thank you. Enjoy the rest of your day. Thank you.